Welcome to Monday Re Tsene with Well Life Inc. This month of November, we have been talking about anxiety, about bipolar, although bipolar is different from anxiety and OCD. OCD, which is obsessive compulsive disorder. I don't think we have touched on it much. We have mainly spoken about anxiety. Shelinga has spoken about anxiety in children, and then various other speakers as well. So I'm just going to give some highlights, and hopefully sometime in maybe February or March, I will also do an in-depth, we'll go a little bit into depth, and hopefully maybe even have an interview with somebody that have experienced what I'm going to be talking about. So as I mentioned, the topic for today is OCD, which stands for obsessive compulsive disorder. The obsessive compulsive disorder is divided into the two. So the obsessive, which is the obsession, and then compulsive, which is the behavior. So the obsession is the thoughts, the compulsion is the behavior of trying to then, ward off the thoughts, but then it becomes a vicious cycle, because the more you do this behavior, the more the thoughts also come. So what are these thoughts? What are these behaviors? So these thoughts can be fear of contamination of viruses. So I think you might have even heard a lot of people saying during COVID that a person is so OCD because, wherever they were, they wanted to sanitize, they wanted to make sure that whatever they touch, it is sanitized. So people actually, I think to some extent, yes, maybe it's not the clinical, characterization of OCD, but they became quite obsessed about contaminating the virus because of the threat of dying. And another obsession also a person can have, it's an obsession of dying. They can be so preoccupied about dying that there is this ritualistic behavior, which are compulsions that they do around or make sure, either fear of them dying or fear of somebody, a loved one. I was actually recently with a client who had a debilitating fear of, one of their child or dying, or even themselves dying. So she kept on checking on their child all so often that child will not even be able to sleep because they were afraid that they're gonna die in their sleep. The SIDS, which is the COD syndrome or sleep syndrome, sudden death syndrome or sudden infant death syndrome. Sorry, SID, SID, sudden infant death syndrome. So they kept on checking on the child also often that the child never got any sleep because they were afraid that what if the child stopped breathing while they are sleeping. They were also afraid of their own mortality, to say, I just gave birth to a newborn. What if I die and I do not have the chance to raise this child just like myself, who was not raised by my mother? My mother passed on when I was little, and it came from that. So we needed to then work through the childhood of her not having her mother raise her, and which became the fear that what if I die also young and I'm unable to raise my child. So hypervigilance, and this is where maybe there is also trauma, PTSD, post-traumatic stress disorder. I've spoken about it, previously. You can check out the video to learn more. So a person becomes so hypervigilant. Yes, hypervigilant is expected when there is a traumatic event. So, for example, I have shared with you my own story about sexual abuse, and when I, when my children were still very young, and I think to some extent even today, I will make sure, that they do not go to places where they could be exposed, where they could be harmed. Now in their a little bit older age, I will ask, who were you with? Did that person touch you? Did they talk to you this way? Did somebody exchange a phone with you to show you this and that? And that can be to some extent, an obsession if then I am overdoing it. But that is part of my hypervigilance happens because of my own trauma. So it can come into those hoarding as well. Hoarding, it's one of the obsessions that a person can have, and usually people then hoard as a result of having lost. So when somebody has lost something significant to them, someone that is significant to them, they will tend to then hoard so that they minimize the pain of loss. So that then will be a compulsion in terms of their behavior. So how does that look like? So it will look like somebody checking and rechecking if they have, closed the doors. If they are hypervigilant, they will check and recheck the stove if they have switched it off. I was interviewing somebody, years ago. It was actually a TV show, and the case study was a guest and myself as an expert. And the person was saying, I am forever late. I am late every day because always, whenever I go out of my house, I'm thinking, did I lock? Did I switch off the stove? Did I do this? So these are then the rituals that the person will do to minimize the anxiety that they are feeling and the obsessions that they have about maybe the house burning or, them knocking something or a robbery. And as I'm saying, it stems from something, it stems from an experience. Or somebody, they will be walking on a pavement and they will avoid to step on the line of the pavement if the pavement is in blocks, because they believe, magically that if I do not step on the line, therefore something disastrous is not going to happen. So these are some of the signs. And as I said, I am giving a very skimmed overview of this for you to just understand. And we say it is a disorder when it is in the way of normal functioning. So yes, you could be obsessed about cleanliness. You have friends that you go to their houses and their houses smell like bleach and domestos, or handy. They are forever sanitizing things. Their white stuff is forever white. I actually have a friend, and during I think early career years, in his first car, I'm not sure if he still does that, and I'm sure he still does. So he will soak his socks and then put sunlight on, and then still wash them and then put them in the washing machine again, just so that they can be white. The same friend, and I'm sure he knows that I'm speaking about him, he will go into his car, put his legs together so that the dust from outside is not in the car, and then also just make sure that he brushes the mat off. But that is him being a clean person, and not necessarily that he is obsessed with dirt, so he can do with germs and so on. But when it is in the way of normal functioning, where you are forever late, where you are, you go crazy when there is no bleach. You go crazy when you cannot find handy to sanitize the countertops, so it drives you up the walls. Where for somebody who does not have the disorder, the bleach will not be there, or the domestos or handy will not be there, and for them it will be okay. We'll use something that is an alternative of sanitizing those countertops. So where we say it is a disorder, it is where it is affecting and impacting negatively on your daily functioning. And yes, this you can process through therapy. In extreme cases, obviously, medication would be indicated, but it is, a brief explanation. And in the next episode that I'm promising to record, I will go into maybe some of the causes and also the treatments as well. With that, this is Re Tsene with Well Life Inc.